Welcome back. Today we're going to be discussing structures of the male reproductive system. And as you can see, I have two different models here. This is a sagittal model. It shows sort of half of the reproductive system. And this is a three-dimensional model. And I'm going to be using both of them. But as you can see, if we were to just pull this apart, the two models are really showing the same types of things. So I'm going to be using both of them. I like to start discussing the reproductive system with where the sperm are actually created, and I'll end with where they leave the body during ejaculation. So we start here in the testes, and remember we have two testes. There's one on either side, so this is a paired structure, and the testes again are the primary organ of the reproductive system because that's what's making the sperm. That's where spermatogenesis happens. That's where meiosis is happening. So the seminiferous tubules are shown here. That's where the sperm are going through meiosis, 1 and 2. And when they're finished with spermatogenesis and they're fully formed, they're going to move into this structure here. This is called the epididymis. The epididymis is where they kind of finish maturing and getting ready, learning how to swim, and getting ready for ejaculation. You can also see this layer right here, the dark red layer, is the cremaster muscle. And remember, the cremaster muscle is the muscle that can contract and help to pull the testes closer to the body when they need to stay warmer, if it's very cold out, or it will relax and allow the testes to hang further away from the body when we need to lower the temperature in the testes. So during ejaculation, the sperm are going to move out of the epididymis and into the vas deferens. You can see the vas deferens on the back here, this tube. Sometimes this is called the ductus deferens. I'm going to quickly shift over to this model. Here's the testes, and here's the ductus deferens. And you can really see on this model, this is the bladder right here. So it's going to move up, hook over the pubis bone, go around on the superior side to the posterior side of the bladder. You can see this gland right here. This is called seminal vesicle. And the seminal vesicle contributes a lot of fluid to semen. Now remember, semen is made up of sperm and other fluid. So semen isn't just sperm. You can see the seminal vesicle on this model right here. So as the sperm leave the testes in the ductus deferens or the vas deferens, it's going to merge with fluid coming from the seminal vesicle. They're going to merge together right here in the ejaculatory duct. Now, the seminal vesicle produces a fluid that is very high in fructose. Fructose is a sugar. This fluid helps the sperm's mobility because they need to make a lot of ATP to run the flagella. So to make ATP, you need sugar. So the fructose that is produced in the seminal vesicle helps to provide mobility to the sperm. The ejaculatory duct is going to move through this gland here called the prostate gland, and it's going to fuse with and join with the urethra. Now remember, from the urinary system, the urethra is the tube that drains the bladder out of the body. So the ejaculatory duct is going to meet with the urethra right about here at the end of the prostate gland. The prostate gland also produces some fluid for the semen. The prostate gland produces an alkaline fluid to help neutralize the acidity of the vagina. Sperm do not like acidic conditions, so the prostate gland produces this alkaline fluid. In terms of volume, the seminal vesicle produces about 70% of the volume of the fluid in semen, and the prostate gland produces about 30% of the volume of fluid in semen. The urethra moves through all of these structures and out of the penis, but there's actually 3 different sections. So this section right here is called the prostatic urethra because it's moving through the prostate. This section here where it's moving through the body wall is called the membranous urethra. And then this section, as it's moving through the penis, is called the spongy urethra. As we move out through the body wall, there's one other gland that helps in this process. So we have the seminal vesicle, we have the prostate gland, we also have this little one, which is called the bulbourethral gland. It doesn't actually contribute much to the volume of semen, but it secretes a very slippery kind of egg white-like substance that helps to clean out the urethra and lubricate the urethra, as well as lubricating the tip of the penis. Now, the reason for this is because this is a shared tube. You're going to have urine coming through here as well as semen coming through here. And because the sperm don't like an acidic environment and urine is very acidic, we want to make sure that all of that urine has been cleaned out so it's not going to kill off our sperm before we can get it into the vagina. Somebody's printing something. So as the penis itself is shown here, and there's a couple of different types of erectile tissue here. The one that is around the urethra is called the corpus spongiosum. So that's where that spongy urethra name comes from. So that's this on either side of and surrounding the urethra. And the reason that's there is that it's very important that during an erection, this tube stays open. So instead of squeezing the urethra closed, it actually expands outward away from the tube to help maintain this opening during an erection. There are two columns of erectile tissue on the top of the penis here, and I call it the top, but it's actually the dorsal side. So think about that. If it's the dorsal side of the penis, the dorsal is the back side of the body, that means in correct anatomical position, the penis is actually erect. So the dorsal side is this top side. These columns of erectile tissue are called the corpus cavernosum. So the corpus cavernosum is the erectile tissue that will become engorged with blood and make the penis erect and stiff enough for sexual intercourse. And the corpus spongiosum is the part that becomes engorged and maintains the urethral opening. You can see that on this model. You can see the different types. I'm going to actually pull the penis off here. Hold on a second. This does not want to come off. So you can see the three different columns of erectile tissue. It kind of looks like a face. This is the corpus spongiosum around the urethra, and this is the corpus cavernosum, these two columns of erectile tissue that maintain the erection in the male during sexual intercourse. One of the issues that men have as they get older is the prostate becomes enlarged. And as you can see, you have not only the urethra, but the ejaculatory duct running through it. One way that doctors can tell what's going on with the prostate is to do a prostate exam. They would put their finger into the rectum, and then they can palpate forward and feel just how enlarged this prostate is. This can cause a lot of problems with urination in men as they grow older. The end of the penis is called the glans penis, and the skin around the glans penis is actually called the prepuce. And that prepuce is what is sometimes removed during circumcision. That's it for the male reproductive system. See you in class.